Bismillahirrahmanirrahim. Let's start with the quote of the day. Sometimes life does not give you what you want, not because you do not deserve it, but because you deserve more. I'll be giving today's presentation. So, my name is Dr. Amna Khan. The topic I'll be presenting today is trichomoniasis. I'll be presenting this topic under supervision of my most respectable, most honorable supervisor, Dr. Saraf. Learning outlines for today are introduction, epidemiological factors, chain of transmission, clinical manifestations, levels of prevention, and recent advances in MCQs. Learning outcomes for today would be, at the end of this presentation, students will be able to describe the epidemiological aspects of trichomoniasis, preventive aspects of trichomoniasis, national and global updates, and recent advances. Introduction. Trichomoniasis or trich is a very commonly sexually transmitted disease. It is caused by infection with a protozoan parasite called Trichomonas vaginalis. Although symptoms of the disease vary, most people who have the parasite cannot tell they are infected. Problem statement. In comparison to chlamydia and other STIs, with prevalence rates highest in women ages 15 to 25 years, trichomoniasis infection appear to peak substantially later in life, between 40 to 50 years of age. The infection is asymptomatic in at least 50% of women and 70 to 80% of men. Symptomatic trichomoniasis present with vaginal or urethral discharge, pelvic pain, dysuria, painful urination, and itching of the genitals. Trichomoniasis infection in pregnant women can cause adverse pregnancy outcomes, particularly premature rupture of membranes, preterm delivery, and low birth weight. Sector strategy on sexually transmitted infections, 2016 to 2021. In May 2016, the World Health Assembly adopted the Global Health Sector Strategy on Sexually Transmitted Infections, 2016 to 2021. This strategy includes rapid scale-up of evidence-based interventions and services to end sexually transmitted infections as public health concerns by 2030. The strategy sets targets for reductions in gonorrhea and syphilis incidence in adults and recommends the establishment of global baseline incidences of sexually transmitted infections by 2018. Objective. The primary objectives of the study were to estimate the 2016 global and regional prevalence and incidence of chlamydia, gonorrhea, trichomoniasis, and syphilis in adult women and men. Now, I'll be giving a case presentation. An 18-year-old girl presents to her pediatrician with her mother for a pre-college checkup. She has no past medical history. After her mother leaves the room for the social history component, the girl admits to having sex with her boyfriend for the first time 2 weeks ago and complains of a yellow-green malodorous vaginal discharge that started a week ago. She endorses mild pelvic pain. A pelvic exam is performed and mild cervical tenderness is noted. The cervix is pink, nulliparous, inflamed, and is covered by small red punctate spots. A thin yellow-green frothy discharge of fishy odor is also detected. A wet prep is made and reveals squamous cells and numerous motile organisms. The epidemiological triangle consists of agent, host, and environment. So agent is the Trichomonas vaginalis. A flagellate is the most common pathogenic protozoan of humans in industrialized countries. Host factors are the risk factors for acquiring trichomoniasis. People with more sexual partners are more likely to become infected. Other risk factors for infection may include limited education and low socioeconomic status. So the etiological agent Trichomonas vaginalis is a single self-flagellated protozoan. Humans are the only host, sexually transmitted, can also cause urinary tract infection. Environmental factors. Trichomonal infection has been encountered in every continent and climate and with no seasonal variability. Trichomonas vaginalis habitat. So the T. vaginalis trophocyte lives in the vagina and urethra of the infected females, prostate of infected males transmitted during sexual intercourse from infected partner to the other. Modes of transmission. It was always believed to be a sexually transmitted disease. But an extensive literature search shows that non-sexual transmission of trichomonas can occur through fomites like towels and toilet seats and from the swimming pools. Trophozoite cannot survive outside, and so infection has to be transmitted directly from person to person. Sexual transmission is the usual mode of transmission. Trichomoniasis often coexist with other sexually transmitted diseases like candidiasis, gonorrhea, syphilis, or HIV. Babies may get infected during birth. Fomites such as towels have been implicated in transmission. Trophozoite divides by binary fission. Incubation period is roughly 10 days. The incubation period, some people with symptoms get within 5 to 28 days after being infected, but others do not develop symptoms until much later. Symptoms can come and go. And without treatment, the infection can last for months or even years. Pathogenesis and clinical picture. In women, trophocytes feed on mucosal surface of vagina and urethra, producing sloughing of squamous epithelial cells. It's 50%, in the 50% of cases, it's asymptomatic. Profuse odorous discharge, burning, itching, frequency of urination, and dysuria and dyspareunia. On examination, there would be excessive discharge, diffuse vulval erythema, vaginal wall inflammation, a term called strawberry cervix. In men, infection is frequently asymptomatic. Symptoms appear when infection involves prostate or higher part of the urogenital tract. Thin discharge, dysuria, and nocturia on examination, enlarged tender prostate and epididymitis. Signs and symptoms. About 70% of the infected people do not have any signs or symptoms. When trichomoniasis does cause symptoms, they can range from mild irritation to severe inflammation. Some people with symptoms get them within 5 to 28 days after being infected. Others do not develop symptoms until much later. Symptoms can come and go. For females, they would include gray or yellowish vaginal discharge, vaginal bleeding, genital burning, genital swelling, frequent urge to urinate, and pain during sex. And for the males, the symptoms would be discharge from urethra, burning during urination or after ejaculation, and urge to urinate frequently. Complications. So these can increase this infection can increase the risk of getting or spreading other sexually transmitted infections. For example, trichomoniasis can cause genital inflammation that makes it easier to get infected with HIV or to pass the HIV virus onto a sex partner. It affects a pregnant woman and her baby. Pregnant women are more likely to have their babies too early preterm delivery. Also, babies born to infected mothers are more likely to have a low birth weight, less than 5.5 pounds. There are different levels of prevention: the primordial prevention, primary prevention, secondary prevention, tertiary prevention. So primordial prevention would be for the country and the global level policies, and primary prevention for persons without extremist violence behaviors. Secondary prevention would be the level of persons with at risk of preclinical and the pre-criminal behaviors, and tertiary prevention for the person with extremist violent behavior. Prevention and control includes safe sexual behavior, avoidance of multiple sex partners, use of condom, detection and treatment of case either male or female. Prevention includes use condoms. Condoms are the best way to prevent sexually transmitted infections when you have sex. Get tested. Be sure you and your partner are tested for the STIs. Be monogamous. Limit your number of sex partners. And do not abuse alcohol or drugs. TrichGuard contains scaled concentrated cultures of Trichomonas fetus suspended in a special oil adjuvant. General directions: administer 1 to 2 ml dose subcutaneously in the neck or behind the shoulder using aseptic technique. A second dose should be administered 2 to 4 weeks later. The last injection should precede the breeding season by not less than 4 weeks. Annual revaccination and annual booster vaccination with a single dose should precede the breeding season by not less than 4 weeks. No vaccine for humans is developed yet. Secondary prevention includes early diagnosis and prompt treatment. Diagnosis, it is not possible to diagnose the trichomoniasis based on the symptoms alone for both men and women. Your healthcare provider can examine you and get a lab test to diagnose. So the test would be microscopy, culture, antigen detection in vaginal smears, molecular diagnosis, and other tests. Specimens for the women are vaginal discharge and endocervical specimens. In men, prostatic fluid. Less commonly semen. Common specimens include urethral swab, early morning, first voided urine sediment. Microscopy, trichomonas in the vaginal discharge can be demonstrated by wet mount, pap smear, and the direct fluorescent antibody staining. Culture is the gold standard for the diagnosis. Antigen detection in vaginal smears ELISA is used for demonstration of trichomonas antigen in vaginal specimens. Molecular diagnosis, DNA probes, synthetic oligonucleotide probes. PCR, highly sensitive 97%, specific 98% is for the diagnosis of the Trichomonas vaginalis. Trichomoniasis can be treated by with the medication either metronidazole or tonidazole. These pills are taken by mouth. It is safe for the pregnant woman to take this medication. It is not recommended to drink alcohol within 24 hours after taking these medications. Recommended regimen is metronidazole 2 gram orally and single dose, or tonidazole 2 gram orally and single dose. Alternative regimen includes metronidazole 500 mg orally twice a daily for 7 days. People who have been treated with this trichomoniasis can get it again. About 1 in 5 people get infected again with 3 months after receiving treatment. To avoid getting reinfected, all sex partners should get treated with antibiotics at the same time. Wait to have sex again until everyone has been treated and any other symptoms go away. Get checked about 3 months to make sure you have not been infected again, or sooner if your symptoms come back before then. Diagnosis and management of Trichomonas vaginalis, summary of evidence reviewed for the 2021 Centers for Disease Control and Prevention, Sexually Transmitted Infections Treatment Guidelines. Latest diagnostic techniques include newly available diagnostic methods, including point-of-care assays and multiple nucleic acid amplification tests, can be performed on a variety of genital specimens in women and men, including urine, allowing more accurate and convenient testing and screening of those at risk for infection. Repeat and persistent infections are common in women, thus re-screening at 3 months after treatment is recommended. The latest treatment in vitro antibiotic resistance to 5-nitroimidazole in T. vaginalis remains low, 4.3%, but should be monitored. High rates of T. vaginalis among sexual partners of infected persons suggest a role for expedited partner treatment. A randomized controlled trial in HIV uninfected women demonstrated that multi-dose metronidazole 500 milligram twice daily for 7 days reduced the proportion of women with trichomonas infection at 1 month test of cure compared with the woman receiving single dose therapy 2 gram. The single 2 gram oral metronidazole regimen remains the preferred treatment in men. Now, time for recent advances. Trichomonas vaginalis and growing concern over drug resistance, a systematic review. So the main treatment against the disease in metronidazole is metronidazole and some other nitroimidazole derivatives. However, between 5 and 20% of clinical cases of trichomoniasis are caused by parasite resistance to these drugs. High level of in vitro metronidazole resistance was rare. Low, moderate level was described in most of the cases. Although clinical resistance to metronidazole of trichomoniasis was widely reported, there was a paucity of prospective control studies. Our review unveiled the need to standardize susceptibility testing to define breakpoints for detection of the metronidazole resistance isolates and to correlate with the clinical outcome. It is important to establish criteria to define clinical resistance to metronidazole. Such a consensus would foster the development of surveillance studies about clinical and microbiological responses to metronidazole treatment. Novel treatment approaches to combat trichomoniasis are neglected and sexually transmitted infection caused by Trichomonas vaginalis translational perspective. So, according to this, although related to the curable sexually transmitted infections, the current drugs metronidazole and tonidazole present therapeutic failures. The need for new options to treat trichomoniasis is established by basic research studies and patents revealing novel synthetic compounds and natural products presenting anti-Trichomonas vaginalis activities mainly based on in vitro findings. Clinical trials are still focused on new routes of administration for conventional drugs. In addition, the nanotechnology approaches are in their infancy, shedding light on potential possibilities for creating more effective, targeted, and safe delivery systems. Now, time for the MCQs. The first MCQ is, a 28-year-old African-American woman comes into the sexually transmitted diseases clinic with her boyfriend to get a to get an HIV test and to get screened for any sexually transmitted infections. She has a history of several STDs in the past. The routine infections ordered for this woman included screening for Trichomonas vaginalis infection. Which one of the following would have recommended as the preferred screening test for the detection T. vaginalis infection in the asymptomatic woman? A. Wet mount microscopy of the vaginal secretions. B. Nucleic acid amplification testing on a vaginal swab specimen. C. Culture of first catch urine specimen. D. Culture of a midstream urine specimen. And E. PCR of the vaginal specimen. Anyone would like to answer?
B.
Yes, the answer is B.
A.
The answer is B. Second, a 39-year-old woman presents to clinic with a 5-day history of abnormally increased and slightly malodorous vaginal discharge. She has been sexually active with 2 men in the past and reports that she does not routinely use condoms. Vaginal swabs are sent for nucleic acid amplification testing for sexually transmitted infections and are negative for chlamydia and Neisseria, but positive for the Trichomonas vaginalis. Which one of the following represents the best option to treat this woman's infection? A. Metronidazole 2 gram orally in a single dose. B. Metronidazole 500 mg twice a day for 10 days. C. The metronidazole gel intravaginally daily for 7 days. And E. The metronidazole 2 grams orally in 2 dose.
E. B.
A. The answer is A. Third, a 24-year-old woman recently diagnosed with HIV infection presents with her initial visit with her new primary care provider. She acquired HIV through unprotected vaginal sex with a male partner. As part of her visit, you are planning to do routine screening for sexually transmitted infections. Which one of the following is true regarding Trichomonas vaginalis infection in women with HIV? A. Trichomoniasis screening is most recommended since when the with women with HIV have low prevalence rates when compared with the woman without HIV. B. Lower vaginal and endocervical HIV RNA levels. C. An increased incidence of pelvic PID, pelvic inflammatory diseases, increased genital tract, and enhanced HIV shedding. D. The recommended treatment of trichomoniasis is the same in women with HIV as in the woman without HIV. E. Reduced HIV genital tract shedding.
B.
The answer is C. Fourth, a 19-year-old man returns home after his first semester at college. While away, he had 2 female sexual partners and reports that he rarely used condoms. He's anxious about sexually transmitted infections and requests screening. He mentions that he has read about trichomoniasis on the internet and asks whether he should be tested for this as well. Which one of the following would you recommend regarding testing in this man for Trichomonas vaginalis? A. Urethral swab for the Trichomonas vaginalis culture. Urine sample. The B is urine sample. C. Urine nucleic acid amplification testing for the Trichomonas vaginalis. And D. Do not offer testing as there is no clear benefit to screening asymptomatic men for the Trichomonas vaginalis infection. E. Microscopic sample of the Trichomonas vaginalis.
A.
The answer is D. Fifth, what species of protozoa causes a foul-smelling vaginal discharge with itching and burning, and on physical examination shows a fiery red cervix? A. Entamoeba, B. Trypanosoma, C. Trichomonas, D. Leishmania, or E. Plasmodium?
C.
Yes,
C.
yes, it's
C.
short. C. 6. A young woman goes to her doctor with a variety of medical complaints. Her mucosal surfaces are tender, inflamed, eroded, and covered with a yellowish discharge. For one problem, the lab reports the isolation of a pear-shaped protozoan with a whip-like motility. The organism is absorbed in which of the following? A. Biopsied muscle, B. Blood, C. Duodenal contents, D. sputum, or E. Vaginal secretions?
E. E.
Yes, E. 7. A 25-year-old woman at 20-week gestation is told that her infection can cause preterm birth, but has very little other effect on the baby. What is the single most likely infective organism responsible for the clinical characteristic described? A. Cytomegalovirus. B. Herpes simplex. C. Hepatitis B. D. Gonorrhea, or E. Trichomonas?
E. E.
Yes, the answer is E. 8, which statement about the trichomonas is true? It is sexually transmitted disease by a protozoan. B, it is usually incurable. C, men often show symptoms while women do not. D, contact with the contaminated dry surface can lead to infection. E, pregnant women infected with trichomonas often have spontaneous abortions.
A.
Yes, the answer is A. 9th, a young woman presents to the genitourinary medicine clinic after a vaginal swab was taken from the posterior fornix. Microscopic examination reveals the trichomonas vaginalis. The trichomoniasis is transmitted by which stage? A, cyst. B, oocyst. C, egg. D, sporocyte. E, trophocyte.
E.
Yes, E, trophocyte. 10th, a 63-year-old woman is evaluated for a 3-week history of vaginal discharge. The discharge is described by as yellowish and malodorous and is accompanied by burning and dyspareunia. Testing for the trichomonas vaginalis is positive. Treatment with single-dose metronidazole is planned. Which of the following is the most appropriate additional intervention? A, confirm infection with the nucleic acid amplification test. B, perform repeat pap smear. C, test for cure following treatment. D, treat the patient's sexual partner. E, consult the patient and send her home.
D.
Yes, the answer is D. Here's the key of the MCQs. Thank you so much, everyone, for the patience. And here's the YouTube
Thank you.
channel.
Okay, thank you very much, Dr. Amna. This is a wonderful presentation. And especially you have talked about the MCQs. They are very well thought of. And you have also presented the clinical scenarios. Very well done. See you today in the department. Allah Hafiz.
Allah Hafiz, ma'am. Thank you so much.